today's live streaming. All right. Happy Sunday, guys. Happy Sunday to all Healthy Living Global family members, both the ones within the country and outside the country. All right. I welcome you guys to today's live streaming. I am Health Educator Mike, as you all know. Please, if you are joining us for the first time, do not forget to subscribe to this channel, and also turn on your notification. And please be aware that we stream every day by 10 a.m. Then on Sunday between 12 to 3 p.m. So we stream that is in between, so you can stream within these hours. So today we are starting few minutes after 2. So that's how we stream that local time for those that are abroad. We are streaming with a Nigerian time. This time is a timing of a Nigerian, like the local time. All right, so welcome to today's live streaming. If you are with us yesterday, day before yesterday, I think we used that 2 days to discuss about some ingredients in cream that is capable of making us to develop cancer or that are carcinogenic. So we discussed that, and if you want to know what we discussed about that, you can actually go back to those videos and watch it out. You are going to see some creams that will mention like the hydroquinone, the mercurial chloride, some topical steroid, and other, even the one that have tar that we normally see in our cream. All right, but in some countries they are banned it, and some countries they are still using it, and most of them are whitening cream. So which I encourage you guys that please, if you see anything whitening cream or cream that do not have a SPF, which is some protection factor, please run away from it. Or um, any cream that will promise you to be light overnight, please, you need to run away from it. Or the cream that have all those chemicals we mentioned. So all those things are not good for your skin. All right, that will kind of expose your skin to sunlight or increase what sensitivity, photo sensitivity. All right, your skin will be more sensitive to ultraviolet radiation. So that's what happens, and you need to take note of that. So do well to prevent them by not using those creams, and if more use it, please get your SPF, right, some protection. And of course, I mentioned that what increases the chances of all this thing happening is your exposure to sunlight. So if you are always exposed to sunlight, please, all those whitening lotions may not be needed for you. Of course, many of them do a lot of work, like this typical corticosteroid like clobetasol, betamethasone. They work very well, right, in removing the knuckles and even dark spots, right? They work fine, but now um, when you use it for a prolonged period of time, is capable of making you to develop cancer. So which is the reason we always encourage be very careful, right? Read the label and know the ingredients. If it contains any of all these creams, so please do well to use SPF 30, 60 or thereabout, which is some protection 30, some protection 60 is there, is in cosmetics market. So because of the demand of the people, um, everybody want to become light overnight. All right, it have made the production companies to go extra mile in adding even some ingredients that are not recommended. That so far is going to make you white overnight to meet up with your demand. So please, we need to be very careful. Prevention of cancer is very cheap, but the treatment is not cheap. Let no one deceive you. Please take note of that. So that's what we have been discussing. We discussed yesterday and day for yesterday. So other days we have a lot of things we have discussed. Now, as you all know, this is a platform for um health awareness, right? We create awareness, we believe on health promotion, we promote health, we promote health prevention, and also we encourage you guys to live what a healthier life. So always share a link of this live streaming channel and also the link of this channel, all right, this YouTube channel, to the groups where you belong to, or your friends and loved ones that would want them to benefit from our live streaming here. We discuss a lot of things, very critical things that are related to our health, things that is going to improve our health if we are to obey the guidelines. And we need to be aware of some certain things that can be a challenge to our health. All those things will enable us to live a healthier life, guys. That is our goal. If you are following this particular channel with devotion, with commitment, of course, you must learn something. There's something you need to learn, right? You need to stay on the know. We have discussed a lot of things about different silent killer diseases. We have discussed a lot of things, even infertility in male, fertility in female, many things, right? We have discussed in this channel. All right, I've discussed a lot of things here, and we have debunked a lot of myths, all right, that people are having relating to different challenges, different illness, right? When we bring this might of which is unverified and is not true, we debunk it and I explain why. So there's a lot of things we have been discussing here, guys. So do well to be part of this channel. Let this channel um be more visible, right? So please take note, we stream every day by 10 a.m. and on Sunday we stream between 12 to 3 p.m. So please keep to this time. Just come to the live streaming and learn something for the day. All right. Our live streaming does not last more than 1 hour. Just within 1 hour, we are done. Sometimes even 30 minutes, 40 minutes, we are done, depending on the how broad our topic for the day is. Now, guys, today we are diving into a new topic which I will call sleep apnea. Sleep apnea. Now, what is sleep apnea, right? That's what we are going to discuss today. I will need to take note of it. Take note of how critical, how severe this issue can be. And please share this video so that people will learn something from this very live streaming video. Now, when we talk of sleep apnea, is regular stopping and continuing of breathing, regular pauses of breathing, please, so that you not get it wrong, right? Regular pauses of breathing while you are asleep, right? For instance, you are asleep, at a point your breath will stop, all right, and still continue again. So there's a lot of different issues, right? Different things can cause that. And that's what we call sleep apnea, and this can be very dangerous, right? This sleep apnea can be very dangerous, right? To the extent that it can deprive your system of the oxygen it needs, right, to strive. It need to do a lot of activities or keep you alive as you are asleep. Can you imagine just taking pauses before you stop breathing, then you continue again. The little time you stop breathing, you continue again. It can be very dangerous, and I'm going to tell us why. Now, we say what that sleep apnea is what repeated pauses of breathing as you are asleep. That's what sleep apnea is, and the main things that could cause this sleep apnea, which we are going to still look at it as we go about our discussion. And anywhere you do not understand in this discussion, please do well to put it on the comment section. I'm going to attend to it, right? And we are going to move forward. We want to make sure that everyone stays on the know. Any topic we raise, let's know the details of it. Now, I will say that is repeated pauses when you are asleep. That's what sleep apnea is. And there are different types of this sleep apnea. All right, there's one we call obstructive sleep apnea. Yes, obstructive sleep apnea is when the muscles of the throat, all right, is weak, all right. When you're having weakened muscles of the throat, all right, that is blocking your airway, it will make you to be snoring, gasping. As in fact, the snoring sound used to be very different, right? Or even may even be worse than normal snoring that you are hearing, just this regular snoring, right? So when you notice that someone is having that issue, please do well to a kind of tell the person to seek medical help, because at some point the person may not be aware because he's asleep. Do you understand? Is asleep. But I'm going to tell us what the person will experience that will make the person to seek medical help, to know that probably I am having sleep apnea, and seek medical help and do what we call uh, polysomnography, right? Polysomnography is a way of checking your breathing, your heart rate, and your oxygen level while you are asleep. Is a way of diagnosing this sleep apnea. All right. So when you notice some signs, maybe after you must have woken up, then you seek medical help, and um, you are going to do that particular polysomnography, right, to rule it out, to know if there's anything like that. Of course, if you're having this sleep apnea, you are depriving yourself of oxygen, right? And I'm going to elaborate on that. So I say number one of the types of this sleep apnea is obstructive sleep apnea. Yeah, that one, the muscles of the throat or becomes weaker, all right, which makes it to cover the airways, all right. So once it covers the airways, you'll be having what obstruction, and it can make um your breathing not to go easily as expected. It will lead to snoring. All right. It could even be swollen adenoid or even tonsils. Right, can cause that obstructive sleep apnea also. So please take note. Number two that we're going to mention is what we call a central sleep apnea. Yeah, in central sleep apnea, here the part of the brain that is regulating the muscles, intercostal muscle and the diaphragm, that is the muscle that are responsible to carry out this breathing, right? The part of the brain which we call the medulla oblongata, all right, when it fails to send a signal to tell the intercostal muscle and the diaphragm to please breathe, all right, the person may have this sleep apnea. All right, the person may not, the breathing may be pausing at interval, which will affect the person, deprive the person of oxygen. And we have what we call mixed sleep apnea, which is the both, right? Because someone can have the both of them, having this obstruction and also having this central sleep apnea, which the brain refuses to send signal for the muscles responsible for breathing, which is the intercostal muscle and even the diaphragm, to work perfectly. So um, please take note. Those are the types of this sleep apnea. And when someone is having this sleep apnea, you notice what snoring, choking, and other issues, all right, that is noticeable, that the person, someone that is around, all right, we notice it more better, that this person is not actually sleeping fine, but the person may not understand. Being asleep is just like being unconscious, right? You are unconscious, you don't actually know what's happening most of the time, so you are just sleeping. So if you have any question, please put it on the comment section while um continue our discussion. All right, we are going to continue our discussion. If you have further question, if you have any question, if you don't have any question, we move forward. There is no time. All right, there is no time. All right, now let's go over to signs. All right, what are the signs of this sleep apnea? All right, so to for you to know if someone is having the sleep apnea, so what are the common signs of this sleep apnea? Now, at night, at night the person may have this snoring, right? Very serious snoring, all right, which is very worse than any snoring must have heard of. You know, oh, you'll be hearing that, all right, continuously, and the person is having that. Please don't think the person is sleeping fine. The person is not actually sleeping for, like people that will take heavy alcohol, drink, and take very heavy alcohol and sleep, that the person will, and you think the person is enjoying the sleep. Is not enjoying the sleep. This is what we call sleep apnea. The only thing you can do for the person at once is to please raise the person, let the person lie by the side instead of the back. Please let the person lie by the side instead of what? At the back. This can help improve the person's breathing at that particular point in time, because as he's doing that, the body is being deprived of air, all right? And carbon dioxide is being trapped inside, oxygen is not coming inside, right? You know how someone breathes, it will release oxygen as a byproduct and taking, sorry, release carbon dioxide as a byproduct and taking oxygen, right? So now in this case, oxygen is not coming in and carbon dioxide is not going out. So the person can even be at a point, if he persists, the person can be poisoned by excessive carbon dioxide. So if you see someone that is gasping, somebody that is snoring, very heavy snoring, please do well to turn the person, that let's say after taking of alcohol, do well to turn the person, let the person sleep by the side instead of at the back. Very important. So now, and you can even notice it, that is this at night, right? By consistent or maybe regular or repeated pauses, all right, of breathing. Maybe you that is observing, you discover that the person breathe and stop, breathe and stop, all right. It's not normal, it's not normal. That is very dangerous. So you see the person having restless sleep, the person cannot sleep comfortably without any noise and other this. Just know that what the person may have an issue, and which the person may need to go to the health center and seek medical help, right? Because this particular issue may be sleep apnea. The person will do what we call poly polysomnography. Please take note of this. Is a kind of way of diagnosing this condition, right, of this sleep apnea. Now, another sign is by the day, right? By the day, which is, the other one by the night, um, the person may be unconscious, is asleep now, so it's just like someone that is unconscious, you understand, so does not know anything that is happening. But by the day, the person at least have realized himself or herself. So this is how you can be able to tell if you had issues with your breath the previous night, all right, or maybe you didn't sleep fine. Now, the person may be having like this morning headache, right? The person will be having this very strong headache in the morning, all right? Another thing is lack of concentration and unfocused. The person may not be able to focus or concentrate well. Another thing is sleepiness. Person will be a kind of trying to gain sleep, even though the person slept well, slept at night, but the person will be what? Trying to sleep even by the day, right? So when you notice that, just know that probably, and as in repeatedly, you notice it today, tomorrow, next tomorrow, you may need to seek medical help, right? So that they will do what we call polysomnography to know if there is any issue. Because if there is any issue, gradually you are depriving yourself of oxygen. And I'm going to tell you the implication of that. Now, another thing, what The person may be having, I mentioned a headache, even fatigue. The person will be having tiredness, right? The person will be having tiredness or fatigue, right? Even with that headache, all right? So all those things is what can happen to the person by the day. If you sleep at night and wake up in the morning, you are expected to be stronger and vibrant, right? Because you are refreshed. The whole of your system have rested enough. So when you wake up, take your bath, you are expected to be stronger. But if you see yourself still being weak, having fatigue, right? Or you are having this very serious headache, severe headache, or you are still feeling asleep, just know that something have compromised with your sleep at night. So you need to seek medical help or get diagnosed of something like this sleep apnea, which I say the diagnosis is doing what we call polysomnography. So take note. Now the next thing, which is other symptoms that you may feel, is that what may you may wake up frequently to go and pee. All right, if you're having this sleep apnea, you wake up frequently to go and pee, or you're having, let's say, dry mouth, right? Always you're having a dry mouth, or your blood pressure is going higher, higher, higher by the day. All right. If you notice all these things, all right, just know that what you need to seek medical help. Of course, if you did not sleep well at night, right? If you didn't sleep well at night, it's going to raise your blood pressure, because there cortisol will go up. So it will raise your blood pressure. So which is the reason you need to take note of this. And if you're having a dry mouth, right, it's still showing that what you are having this sleep apnea. And if you're having less, you are waking up frequently, you go and pee, all right, at night, you need it within 1 hour, you just go and pee. The other, in next 1 hour, you go and pee, and the urine output is not even reasonable enough. You are just going there to go and urinate, something that doesn't what amount to anything, all right, as if you are having urinary incontinence. So that is still a sign that you may be having sleep apnea, right? Before you know, you wake up, you say you want to go and pee, you want to go and pee like 5 times, 5 times at night. Please take note. Possibly something is wrong in the system. So please take note of that. So those are the common signs that may show that you're having sleep apnea. Now, what are the causes of this sleep apnea? Please, let's take note of this and let us jot this down. It's going to help us. What are the things that are really causing this sleep apnea? Now, number one is excessive weight. If you're having excessive weight, you have this extra weight at the neck region. There is people that will think they are living well, their neck will swell up, all right, as if they are having goiter. They are not having goiter, all right? It just based on their obesity. In fact, their BMI very high, more than 30, all right? And you see them everywhere filled with fat and so on, and their neck is swollen. So that extra weight on the neck can press that muscle that is covering the airway, all right? Like the larynx, all right? It will put pressure to the larynx or the tonsils, right? Or even the adenoid. All those, it can compress those areas, making you to have blockage of the airway. So please take note, extra weight on the neck region is one of the cause of sleep apnea. Hope is clear. Now, number two is what? Large tonsils and adenoid, right? Or which I've mentioned. Okay, and I don't think I've mentioned that. Now, when you are having enlarged tonsils and adenoid, right? All is at the neck region. If it's swollen, let's say it's inflamed or is infected, all right, it can get large, all right. When it gets large, it can block what? The airways. Now, when it blocks the airways, you cannot breathe properly. You will have this sleep apnea, which I've mentioned this in the video I made, I think I think on Saturday or Friday or thereabout, where Dr. Fola Sheyi and her team decided to give free surgical procedures to 65 patients to celebrate a P2B's birthday, all right, that occurred on the 19th of July, all right, of which the name of the surgery is adenotonsillectomy, all right. So when the tonsil is enlarged or the adenoid is enlarged, so it can bring about this sleep apnea, and you need to do away with it with the medical or surgical procedure we call adenotonsillectomy. Please take note. Now, another thing is what narrow airways or jaw structure, all right? That people that are having naturally narrowed airways or the structure of their jaw it does not accommodate a kind of free breathing, right? You cannot breathe properly because of that. So that people that have it naturally, all right, which is one of um this sleep apnea, the one of the causes is what we call family history, all right. So that people that even have it as a family history, their family history having this sleep apnea. So if you have a developmental problem that lead to what problem with the structure um of your jaw, all right, you have naturally narrowed airways, so it can lead to this sleep apnea. So please take note of that. Now, next thing is what age. If you are above 50 years of age, especially that of male, right, above 50 years of age, of course, the muscles that is controlling those areas, like the larynx or even the adenoid, the tone size is getting weaker. All right, so it's getting weaker, and as it's getting weaker, it's relaxing on the airways, and it will lead to what obstructive sleep apnea. So um, if you are having if you're at old age, all right, if you are getting older, like 50 upward, you have a high risk of having this sleep apnea. So it's one of the causes, and you can use what we call CPAP, all right, which we call continuous pressure machine, all right, continuous pressure machine to continuous breathing pressure machine that will enable you to breathe properly, all right. So um so that you get a free breathing, right, that will make you to stay healthy or overcome the sleep apnea. So now the next we are going to mention is smoking, even taking of alcohol, all right, at bedtime. Of course, if you are smoking or you are taking of alcohol um at bedtime, all right, you take excessive alcohol. I've mentioned this, right? You taking excessive alcohol, it will make those muscles to be more relaxed, right? So all those things can make you to have this sleep apnea. And if you are smoking, smoke weakens the nerves, all right. Of course, when it weakens the nerves, it decreases its sensitivity, all right. That are called those intercostal muscle, the diaphragm. It decreases what its sensitivity to receive signal from the medulla oblongata. So that's what happens. So if you are someone that is smoking, all right, or you take heavy alcohol before sleeping, please do not try that at all. Do not try that at all right, because um this can make you to have this sleep apnea. And the last thing we're going to mention here is family history of this sleep apnea, right? People are having this thing running in their family. Of course, which I say one of the way to treat it or to handle it is what you call CPAP. All right, CPAP, using CPAP method, which we call continuous what again, continuous positive airway pressure machine, right? Continuous positive airway pressure machine. So that's what it means, CPAP, continuous pressure airway positive machine. So what does it do? It will be fixed, all right? It will be fixed that is through your airway, which will enable air to be going freely and coming, carbon dioxide, which will be enabling oxygen to go freely and carbon dioxide go out freely without any obstruction. It's just a way to handle it. Now, we are going to um, discuss this very briefly before we enter the treatment proper. Aside the CPAP, there's other techniques that can be used, right, to handle this particular sleep apnea. Now, what are the complications of this or the risk that someone may have if you are having this sleep apnea continuously for a long period of time? What do you stand to a kind of to lose in your body, or what is the negative effect that is going to give on your body over time? All right. If you are having this continuous sleep apnea, you are at a very high risk of having hypertension, stroke, heart disease. Yes. Now, let me be taking it one after the other. All right. Now, if you're having this sleep apnea, I say that what your system have been deprived is constantly or repeatedly being deprived of oxygen. All right. Of course, if your system is deprived of oxygen, you may have problem with the cardiovascular system. And if you have problem with the cardiovascular system, it can lead to hypertension. All right. It can lead to other heart diseases. It can lead to stroke. Yes, it can lead to stroke because the brain stays within shortest minute, let's say up to 6 minutes maximum, all right, staying without oxygen. And of course, your breathing is pausing at interval, all right. So if it pauses at that particular point in time, there is no enough oxygen that will be on the brain, all right. If there is no enough oxygen, which is to say that the brain has been deprived of oxygen. So if your brain is deprived of oxygen for a certain minute, like up to 8 to 10 minutes, some part of the brain can die, all right, making you to have stroke. So that is what happened. It will kind of make some part of it, some part of the brain to die away and to make you to have what? Stroke. So please take note of that. It causes stroke. It can lead to hypertension. It can lead to heart diseases. It can lead to even high sugar level, diabetes. All right. It can bring a complication that will lead to what? Diabetes. So this particular sleep apnea can be dangerous and it can be life-threatening. All right, it can be very life-threatening. And what we make us or is expect to move us to know more about this sleep apnea is that most of the time we may not be aware that we're having sleep apnea. You just wake up, you see yourself being tired, you see yourself sleeping anyhow. Maybe if you are driving, you just sleep off. And of course, one of the complications it can cause also is you having accident by the day if you're someone that is driving, right? Because you didn't sleep well at night, so you may just doze off while you are on steering, and you can have accident and die. Even with people you are carrying, something can happen. So, all these things is something that we actually need to take note of, right? Because there are the complications, right? Maybe you just come, you cannot your oxygen level and your heart rate while you're at sleep. So they will check it and know if you are having this sleep apnea or not. Now, the next treatment we can do is what we call CPAP. CPAP, all right, which we call continuous positive airway pressure machine, all right. continuous positive airway pressure machine, it will enable you, they will fix it, it will enable the person to be breathing properly, that oxygen may go in and carbon dioxide will come out. All right, so that's the number one of the treatment option that you can do if you're having this sleep apnea. Please take the number one. The number two is what? Weight loss. Weight loss. Lose weight and also exercise regularly. And how you are going to lose weight, you must not depend um some for this product that they are advertising. They will tell you overnight that you are going to become slim overnight. If possible, exercise regularly, right? Before you know, you are going to burn down fat and you lose weight, all right? When you lose weight by exercising regularly and you desist from taking sedatives, all right? Any medicine or any like alcohol that make you to be drowsy, all right? Please avoid them, right? Avoid them because those ones can make your muscles to be too relaxed. And if it makes your muscle to be too relaxed, you may be having this sleep apnea without knowing. So alcohol, avoid alcohol before bedtime. If you must take alcohol, take it by the day and don't take excess because of your liver, right? Take it by the day, and when you want to sleep, go to sleep and sleep well and wake up healthy and strong. All right. But if you go and take alcohol, one is going to make your muscles in that area to be too relaxed, which can cover up the um windpipe, all right, or it can even make you to be having fragmented sleep. And that is even one of the things that makes someone that drank alcohol to be having what? A fragmented sleep. And also this waking up to go and urinate, nocturia, all right, is another thing, all right, that can cause someone that is having alcohol to have issues with sleep. So do not take alcohol before bedtime, and also exercise regularly and lose weight is number two way of treating this sleep apnea. Please take note. So I mentioned number one by using CPAP, which I say is continuous positive airway pressure machine, CPAP. Then number two is that what? Reduce weight or lose weight, exercise regularly, and also do not take alcohol or other sedatives before bedside instead of at the back. If you are noticing this sleep apnea, right, you have been noticing it um, that people are telling you about that, or even the one you can observe by yourself, you don't know what's happening, or you go to the health center and they do this polysomnography and discover that something is compromising with your oxygen level and even your breathing level or heart rate, all right, while you are asleep. So it may be sleep apnea, and you want to handle it. Number three that I'm going to do, you sleep by the side instead of at the back. Please take note, all right? If you sleep by that is at the back, you may not get the enough ventilation that you need, enough taking in of oxygen and bringing out carbon dioxide, all right? You may not do it efficiently, but if you sleep by the side, it will help and make it more freer. It will free it the more, all right? And make you to breathe fine. So sleeping by the side instead of by the back is one of the way to handle this sleep um apnea, right? Number three, sorry, we have mentioned number three, right? So number four that I'm going to mention is dental device, all right? Using dental device, that one that will fix it at your jaw, that is going to make your jaw to protrude or make it to shift forward, all right, so that there will be what? Free movement of air uh, into your windpipe. All right, so they will fix it, and we call it what? We call it dental device. All right, so they will use it to safeguard your mouth so that there will be what? Free flow of air in and also carbon dioxide out of your respiratory tract. So all those is a way of handling this sleep apnea so that you can be able to breathe properly, because if you did not get enough oxygen that you need to stay alive, of course, in fact, it's to be dangerous for you. It will be very complicated for you. It can destroy many things which we have mentioned. Now, number 5 of the things you can do when you're having this sleep apnea. Check if you are having swollen adenoid and tonsils. If you're having swollen adenoid on tonsils, you do what we call adenotonsillectomy. I keep saying it. I keep saying this, right? I've said it before. I think during introductory part or at the beginning, I say one of the way to handle this sleep related breathing disorder, right? All this disorder that of sleep that is related to your breathing issue, right? So is another way to handle it, all right? Just like this one of which the doctors want to do as a free surgical procedure for 65 children, all right? Adenotonsillectomy, all right, which is capable of affecting those children and even reducing their growth. Of course, when you're having problem with the adenoid and the tonsils, right, it can deprive the child of the right growth that is supposed, because all those ones still regulate this growth and development in a child. So um, the child need to grow well by you taking the child to undergo this adenotonsillectomy. All right, if he's having swollen tonsils or adenoid, all right, or infected tonsils or adenoid. So as we speak now, there is still the free surgery going on about this adenotonsillectomy. Is still free for 65 children across the country. So if your child is having such issue, see your child breathing with force, all right, and not having restless sleep, all right, all those issues. If you notice that your child is having those issue of sleep apnea, and you go like to diagnose the child, or maybe they do x-ray and discover that the adenoid is swollen, or the tonsils is swollen, so quickly reach out to Dr. Folashi and her team. If they have not exhausted this number, these 65 patients, they still within the these 65, they can attend to your child free of charge, and they will do this surgical procedure. Their health center or their hospital is located in Lagos State. So that transport is nothing as compared to the amount of this surgical procedure. All right, so that is it. And this they have used it to help people when it comes to the healthcare. All right, they have used it to, in fact, they contributed to the public health, because with it, it have improved the health of at least 65 children. So which is amount to something when it comes to public health. Now, I said that what number 5 of handling this sleep apnea is what adenotonsillectomy. Even in adult, you can still do it, right? In adult, this procedure. So if someone is having this regular sleep disorder or issues with sleep, right, of which every test is showing that what is a swollen adenoid or infected adenoid, or the person having a swollen tonsils or infected tonsils, or the both at a time, it's better the person go for a procedure called adenotonsillectomy. All right, they will surgically remove the adenoid and the tonsils so that you can breathe properly whenever you are sleeping at night. So all those things will help you so that your health will be improved. So it will not compromise with your oxygen level in your system, and also not will also enable carbon dioxide to come out freely without getting trapped in the respiratory tract. So please take note of this. Is number five way of handling or treating sleep apnea. Now, another thing we are going to discuss, which is the last one, is what treating the underlying causes. What are underlying causes? Can be problem with the thyroid, right? Problem with the thyroid. It can be a problem um, with the nose, right? Nasal problems, right? So it can be problem with the thyroid gland, right? That is around the throat region, all right? And it can also be problem with the nose. So if there is any underlying causes like maybe obstruction in the nose that's making you um, to have this sleep apnea, like a nasal congestion, because a very serious nasal congestion can still uh, bring about this sleep apnea. All right, so if you're having such a thing, you go for the treatment to make sure that what you remove that underlying cause. And if you're having any problem with your thyroid gland, you still do, let's say you're having something like goiter, right, or any issues are related to that, you can still go and do treat the underlying cause. Of course, if you're having problem with your thyroid gland, it can affect the person's growth and development. So, which is the reason um, that that surgical procedure that was offered to 65 patients, it will enable them, which is adenotonsillectomy, it will enable them to grow fine and also develop properly as children. So anything that depriving their growth, it will correct it. So that is what that procedure will do. So that is it. I think we have done justice to this very topic of sleep apnea. We have done justice to this very topic. Please, if you are joining us for the first time, do well to subscribe to our YouTube channel. It's in this channel that we bring about health promotion, disease prevention. We create awareness. We discuss about many things that could help us to grow and um, uplift us when it comes to our health. All right. So everyone's supposed to be in this place. We're expected to be here. We say it's healthy living global, taking our health or healthy living to a global scale. It needs people in US, it needs people in India, it needs people in South Africa, it needs people. We don't discriminate in Russia, in Ukraine, everywhere. Come and join our live streaming, right? Here, what we do is strictly health promotion. Health promotion. So I've recorded a lot of people join us from different countries: South Africa, USA, um, India, even that of Nigerian here. So a lot of people have been joining this live stream. Please let us not give up. We're not backing down. The management of this particular healthy living live streaming is not backing down. So we are always committed to see that we move this goal to the the next level. We bring about the realities of everything we are doing here or what we proposed, all right, to achieve on this platform. So do well to tell others that we tell others that we tell others that Healthy Living Global is existing. That Healthy Living Global is a channel where you can learn, all right, that accommodates both the health workers and healthcare providers and helping us to live what a healthier life. So once you join this group, join this channel, all right, subscribe, you turn on notification, you do well to um, stay behind. Each day we are doing our live streaming. I say our live streaming every day by 10 a.m. and on Sunday between 12 to 3 p.m. So we are always streaming, right? And in each of our streaming, there's a lot of things to learn. If you're a healthcare provider, you are going to learn new things, all right? Learn some updates that is coming from Healthy Living Global, all right? And if you're a healthcare consumer, like all of us are, you are going to learn something to make you to stay on the know. At least with all this our discussion, you have gotten the overview of sleep apnea, what it is all about. And if you did not get it, I'll still do a recap. And if you did not understand it from that recap, ask question on the comment section. You'll be clarified. That is our major goal, to make you to stay on the know. Just have idea of what you are doing, have idea about your health, what your health is all about, right? And know how you are going to live a healthier life. So instead of saying you don't know how this one come, whether it's village, let us live village people. Let us do the one we can, that's within our own limit. It will help us to live a healthier life instead of pushing blames on this person, pushing blame on this. So let us um, live what a healthier life is going to help us um, to grow as a family. So a very quick recap. Today we discussed about sleep apnea. Yeah, sleep apnea, we discussed about it, and we say that sleep apnea is what repeated pauses of breathing while you are asleep. Yeah, like when you sleep, at a point your breath will cease and still continue again. So when it happening repeatedly, we say it was sleep apnea. And there are many things that could cause this sleep apnea, of which we started by mentioning a type of sleep apnea where we have obstructive sleep apnea and we have central sleep apnea. Said obstructive sleep apnea is when the throat muscle is weakened, right? That is, it will make you to cover the airway or the windpipe. And the central sleep apnea is when the central nervous system, which is the medulla oblongata that is located at the brain stem, right, fail to send a signal to the intercostal muscle and the diaphragm that regulate breathing, right, and makes it unable to breathe. So it will make you to have what sleep apnea. We have mixed sleep apnea, which is both of them combined together. So, and there are many things that could cause this sleep apnea. It can be maybe when you are having excessive weight, all right, around your throat region, or you are taking a sedative, all right, that is before you sleep, or you take excessive alcohol, or um you that is when you take excessive alcohol, and which makes your those muscle right in that area to be too relaxed. So all those things can make you to have this sleep apnea. And we say even age also can contribute to this sleep apnea. If you are aged already, maybe above 50 years, and result even if you are male, all right, it's part of the things that could lead to this. That is some male, all right, normally have it, especially those above this 50 years of age. Now we have even family history, all right, of sleep apnea, and we say that there is some that is even caused by what, due to the structure of the jaw, all right, due to the structure, they have naturally what we call narrowed airways, right? So there is still part of the causes of this sleep apnea. So we need to take note. Even we mentioned even swollen adenoid, swollen tonsils, all right, as causes of what, this sleep apnea. All right, so all those things can be the cause, and there are symptoms that we mention. We say that what, while you are asleep, what the symptom that someone can help you detect while you are asleep is when you are snoring. Snoring as in very strong or severe snoring, or you are having restless sleep, or there is frequent pauses within the sleep, or you are gasping or choking while you are asleep, all right, it's showing that what, you are having sleep apnea. And I say by the day, if you are having sleep apnea, you may notice very severe headache in the morning. You see tiredness and fatigue, all right, and you'll be sleeping or maybe feeling very dizzy by the day. It will tell you that something must have happened to your sleep at night. So all those things is a sign, and you need to go for what we call polysomnography to rule it out and know how you are going to treat it. And I see also there's other signs like waking up frequently to go and urinate at night, right, of which there is no reasonable output, all right, just like in the case of urinary incontinence, right, you just wake up to go and urinate and so on. So all those things are the signs that we need to take note of and know that probably something is wrong and we need to go for diagnosis. And if we get diagnosed, we get treated of this sleep apnea. And there are many ways to treat it, which I mentioned. I say by using CPAP, which is a continuous positive airway pressure machine, right? Use it to open up that airway so that oxygen will go in, carbon dioxide can come out freely. And also by using um, uh, after the this thing, the CPAP, all right, you can even surgically, all right, remove what we call adenoid. Just if you know the cause, if you know the cause, then you can be able to know how to handle it, right? Let's say if it's a sort of adenoid, problem with adenoid or even tonsillitis, you do what we call adenotonsillectomy, right? So that will handle that particular issue. Another ways that which you can be able to do away with this sleep apnea, even making sure that you do not take alcohol before going to bed, or do not take sedatives before going to bed, right? It will still help you to what, treat this sleep apnea. Sleeping by the side instead of at the back will still help you to treat this sleep apnea. Another thing I will mention, this is just a recap, right? So please, if you don't understand anything about this, put it on the comment section. I'm going to attend to it, and please do not allow this video to go unshared. Please, this video will help to sustain someone. This video will help to save someone from dying. I tell you, share this video. Let people learn from this video. This is up to 1 hour plus, but I tell you, the benefit of watching this video will outweigh the data that you have spent for this video. All right, so please do well to share the video, and see you tomorrow for our live streaming by 10 a.m. We are doing our live streaming by 10 a.m. tomorrow, Monday to Saturday, 10 a.m. on Sunday between 12 to 3 p.m. Thank you. See you guys tomorrow for our live streaming. Bye.